So it's with great pleasure that I open our inaugural cross-organization collaboration session for research. It's something that we've been talking about for a while, and I've singled out a few members of the audience here. If anyone from the AACP is there that I've missed out, do let me know, and I'll add you. So at the conference, we had a side meeting. The British Acupuncture Council, the Register of Chinese Herbal Medicine, the Association of Traditional Chinese Medicine, and British Medical Acupuncture Society, and the Acupuncture Association of Chartered Physiotherapists. And we all thought that we need to collaborate more. And one of the easiest places that we can collaborate is research, because by and large, good research benefits us all. And so we decided to have start a few cross-organization simple webinars where we'll invite a speaker, but then we'll also have an opportunity for discussion at the end, so we can have the benefit of a research conference, but maybe on a slightly more regular format. So this is our pilot. This is in effect our pilot study for our first research collaboration. And if it goes well, which I think it will do, because we've got a great turnout tonight, we will repeat it over the next year. So I just wanted to highlight that we've got the chair and medical director of the British Medical Acupuncture Society here, Federico and Mike, if you want to give us a wave. And we also have the CEO of the RCHM, Joanna Teasdale. Yeah, I don't know if you wanted to say a couple of words or just hand over to Fed or Mike.
I said everything I had to say in China.
Great.
We weren't there, Fed. What did you say?
I know, nothing special, but my brain is fried because I just finished clinic. So I will
No problem.
not to embarrass myself.
Okay, well, thank you very much. Thank you very much for organizing this. It's always great to talk about research, and we're looking forward to this evening.
And Mei Xing, I've just quite unfairly highlighted you as well, just to thank the Mei Xing is the president of the ATCM, who's here as well, and Joe too. So I think with that, we'll move straight on to the presentation. So I'm delighted to introduce Dr. John Hughes. John is he appeared at our recent BAcC and RCHM conference, and he is the head of the WHO Cooperating Centre for Traditional, Complementary and Integrative Medicine in the UK. But he's also an associate professor within the School of Medicine and Biosciences, and director of research for the Royal London Hospital for Integrative Medicine. So John wears quite a few hats and is really central in research in the UK, not just for acupuncture, but acupuncture is a big focus of his, but also for the whole field of traditional, complementary and integrative medicine. And John presented a short presentation at the conference, and we thought we'd ask him to do something a little bit longer and more in depth. Some of you may know that the WHO has now published its 10-year, it's 10 years, isn't it, John?
Yeah.
10-year strategy for traditional, complementary and integrative medicine. And it's a strategy that really aligns with the high standards professional community that we all represent. I should also mention that we've also invited all members of the ETCMA, the European Traditional Chinese Medicine Association, to this meeting as well. So greetings to any European friends out there as well. And so it's a really good opportunity because John is somewhat of an insider with the WHO, so he can tell us what the strategy is, outline the key points, and give us an inside view. And at the end of the presentation, you will have the opportunity to ask John questions. And then after that, as I say, we're going to go for a round robin of updates. So if you think you might have an update, or during John's talk, you think, oh, there's something I'd like to share with everybody, in the second stage, you'll be able to share all those updates or ask questions to the whole gathered community here today. And if there are aspects of John's talk that you actually want to explore further, the third section, we're going to split into small groups. And the topic of the small group discussions will be, what are our goals for research? Now, we have some members here who are more focused on herbs, some who are more focused on acupuncture. So we can broaden it out to acupuncture and herbal medicine. But we can have that discussion about what our overall goals are. One of the things that we don't often talk about as a larger community is what should be our overall strategy. And without a strategy, it's harder to actually achieve the bigger goals. So I think that that's something that is really valuable to talk about. We'll split into small groups. I'll ask one person in each small group to take a few notes, and then we'll feed back into the larger group, and we'll collate all those responses at the end so that we can start to develop our own research strategy as we go forward. But with that, I'm going to hand over to John to give his talk. And yes, you'll have an opportunity to ask questions at the end. Please feel free to drop questions in the chat, which John can pick up later as well. I'm happy to read them out to you at the end as well, John. Thanks.
No problem. Thanks, Alex, and evening, everyone. Nice to see a number of familiar faces in the audience. I'll just share my screen. Yeah, so basically this evening, what I'll do is give an overview of some of the work that the WHO's doing that relates to acupuncture. Specifically, I'll just mention a bit about the hospital, the Royal London Hospital for Integrative Medicine, and the process by which we became a WHO collaborating centre in integrative medicine, and some of the work that the WHO asks us to assist them with. I'll then specifically look at the WHO's global strategy for TCIM from 2025 to 34. Look at the WHO's work around traditional medicine ICD codes, specifically focusing on those codes related to traditional Chinese medicine, and then look at the WHO's benchmarks in terms of the training and practice of acupuncture as well. If anybody's got any questions, by the way, as I'm going along, I'm more than happy to be stopped and answer as I'm going along as well. All right. So just to give you a bit of background for those not familiar with the Royal London Hospital for Integrated Medicine, or RLHIM, we were actually formerly known as the Royal London Homeopathic Hospital, and were part of UCLH NHS Foundation Trust. The hospital itself was founded way back in 1849 as a small general hospital with surgical wards and a specialist homeopathic department. However, the hospital joined UCLH in April 2002 and changed its name in 2010 from the Royal London Homeopathic Hospital to the Royal London Hospital for Integrated Medicine, to reflect its change in activity and a shift towards an evidence-based approach to treatment. As everybody knows, integrative medicine brings together conventional medicine with safe and effective complementary medicine. So the hospital itself basically specialises in those TCIM interventions which are within the NICE guidelines. So in terms of acupuncture, that is largely acupuncture for tension type headaches, migraine, and chronic primary pain conditions such as fibromyalgia. Fairly recently, in 2020, the hospital was awarded the status of being a WHO collaborating centre in integrative medicine. Currently, there's just 3 collaborating centres in TCIM for the WHO. That's ourselves, NAFCAM, based in Norway, and a hospital based in Italy. although 2 centres in Germany are about to be officially recognised as being WHO collaborating centres within TCIM as well. In terms of the work that we do with the WHO, the 4 primary assignments that the WHO wants us as a hospital to focus on is around supporting them in developing competency standards within TCIM. So that relates to the benchmarks that I'll be talking about later on acupuncture, but we feed back to the WHO around all of the benchmarks across all TCIM modalities. We also support them in identifying good practices in TCIM. So that includes things like the best ways of incorporating TCIM within national health services and so on. We do a lot of work with the WHO in terms of the traditional medicine ICD codes. And one of the additional roles that I have with the WHO is that I'm the co-chair of the Traditional Medicine Reference Group that oversees globally the work that the WHO is doing with those ICD codes. At the moment, there's 2 traditional medicine ICD codes that the WHO's developed. Those relating to traditional medicine according to what originated in China, but is now a global theoretical approach, as well as Indian-based medicine as well. So that's according to Ayurveda, Siddha, and Unami. And we also are doing work with the WHO specifically around evaluating the current benchmarks for the training and practice of acupuncture. And I'll go on to discuss these in more detail. One of the additional things, because the WHO do ask us to assist them with other things as well. One of the other things that the WHO asked us to assist them with was this global strategy for traditional medicine from 2025 to 34. So myself in particular attended a number of meetings with them with experts from around the world around what should be included within that global strategy. Okay, so recently launched the WHO's global strategy for traditional medicine. It was adopted at the 78th World Health Assembly earlier this year, and the global strategy envisions a world in which everyone has universal access to people-centered traditional, complementary and integrative medicine, contributing to the highest attainable standard of health and well-being. The strategy aims to promote the integration of TCIM into health systems in ways that are evidence-based, culturally respectful, and aligned with sustainable development. So that's the overall aim of this WHO global strategy in TCIM. Now, the global strategy has 4 strands or 4 specific strategic objectives to it. They are strengthening the evidence base for TCIM, supporting the provision of safe and effective TCIM through appropriate regulated mechanisms. And apologies, but you'll probably hear me use the phrase safe and effective quite a lot. It's one of the key objectives with the WHO. The integration of safe and effective TCIM into national health systems and optimizing the cross-sector value of TCIM and empowering communities. Now, I've put in bold at the bottom there, because basically this is the WHO's strategy for TCIM. However, the WHO has no power to insist that member states adopt the strategy. So it's up to all individual member states, including the UK, to decide whether and how to implement these strategies within the document. For those of you who would like to read the full document, it is freely available on the WHO's website, and the HTTPS address is there in the slide. And as it's being recorded, I'm guessing you'll all get access to that later on. So yeah, if anybody does want to look in greater detail at the document, feel free to go on the WHO's website and have a look at that. Now, I'll just look at each of those strategic objectives in a bit more detail. So the first one relates to strengthening the evidence base for TCIM. Basically, the WHO surveys have demonstrated that there's widespread use globally of TCIM. But there's also an acknowledgement that there's a need for more data to advance this evidence base for the safe and effective use and integration of TCIM basically within national health services globally. The WHO acknowledges the fact that the current evidence base indicates that a number of TCIM modalities are both safe and effective for specific conditions, but they acknowledge that that further research needs to be conducted to explore what other conditions these modalities may be beneficial for. So there's two specific directions within this first strategic objective, and that is to facilitate high quality TCIM research through increased resource allocation. Basically, the WHO are asking member states, including the UK, that their research funding bodies increase the amount of research that's allocated to grant applications for TCIM research projects. There is, in terms of the specific research agenda and what research should be funded, the WHO is in the process of identifying or trying to identify a global international research strategy around TCIM. So they've been reaching out both to collaborating centres and member states. Each member state was able to recommend somebody from that country to participate in this process. And I was recently in Copenhagen for a 2-day process with representatives from member states across Europe, as well as the WHO's collaborating centres in TCIM from Europe, to try and identify barriers currently to research within TCIM within Europe. And yeah, you won't be surprised to know that one of those barriers that was discussed in those meetings was around the lack of research funds that is currently allocated to TCIM projects within European member states. There is as well, within the process of facilitating that high quality TCIM research, a objective to try and ensure that TCIM practitioners themselves are involved in the design and conduct of these TCIM research projects, and basically to upskill TCIM practitioners to enable them to undertake research themselves. So that's, again, part of what the WHO is hoping to achieve with this. There's also a desire to increase the amount of real-world research, real world clinical data that's coming out from member states as well. So they're looking to member states to increase the number of projects within the country that, like I say, collects real world clinical outcome data for specific TCIM modalities in specific conditions. And they're also keen to increase the amount of data that's collected through electronic health records primarily within the national health services within member states as well. And yeah, they're looking to explore relevant research approaches. If I'm honest, this was an area where there was a bit of discussion, and on a personal level, I was unsure whether it was necessary, but the WHO, there's enough people that felt that maybe research methodologies need to be explored that could greater enable the capture of the effects seen within TCIM clinical practice. Personally, my own view, I largely feel that the methodologies can encompass TCIM, individualized TCIM fine, as they currently are, and it doesn't really require much adaptation in terms of research methodologies, but it's there within the global strategy. And like I said, also to optimize the utilization of technological advances, which includes, like I say, the collection of electronic records through national health services as well. Looking at strategic objective 2, which is to support the provision of, again, I'm going to use the term, safe and effective TCIM through appropriate regulatory mechanisms. The WHO's position is that regulatory mechanisms are crucial for TCIM to safeguard the public from unsafe or substandard TCIM products and services. The WHO, like myself and like most TCIM researchers, are well aware that not all TCIM works and not all TCIM modalities are going to be beneficial for every condition. So it's a case of trying to put into place certain regulatory mechanisms to ensure that those TCIM modalities, which are unsafe or substandard, they lack that evidence base in terms of effectiveness, there should be regulatory processes in place to try and protect the public from using those modalities. And they recommend regulatory requirements to the specific types of TCIM products or services based upon what the current evidence base is for their safety and efficacy. So if the evidence base currently suggests that a TCIM intervention is unsafe, then, like I say, there should be regulatory mechanisms in place to ensure that the public within member states aren't utilizing those modalities. And likewise, if a TCIM intervention lacks any evidence to support its efficacy, then at worst, the public should be aware that the evidence base currently suggests that it is ineffective. There's 2 specific directives, again relating to strategic objective 2. They are to provide appropriate regulatory mechanisms for TCIM products that are sustainably produced and supplied. Now, this sustainability aspect, again, you'll see it in a couple of the other objectives as well. It's the WHO basically ensuring that across all the recommendations across, conventional medicine, that there is this sustainability component to it. And to provide appropriate regulatory mechanisms for TCIM practices and practitioners. And again, that comes, that also relates to the WHO's benchmarks as well. So for those TCIM interventions which we know are safe and effective, at least in specific conditions, not just acupuncture, including things like, say, Tai Chi, yoga, manual medicine, and psychological therapies like mindfulness, which, after all, is based on Buddhist meditation practices, and I would include within TCIM. That there are regulatory processes and recommendations for what the minimum training for those safe and effective TCIM modalities is, and recommendations for how those practitioners should practice that modality. But like I say, it's up to individual countries, including the UK, whether they do introduce regulatory processes or strengthen the regulatory processes, and specifically how they do it. That's left up to member states. Now, good news for most of the audience, I would think, but strategic objective 3 is the WHO want the integration of safe and effective TCIM into healthcare systems. So they want safe and effective TCIM integrated into health systems, which covers all levels of the healthcare across the care continuum and course. So basically from birth to death, and including all healthcare processes within that remit, that those TCIM interventions of proven safety and effectiveness should be being incorporated into the national health systems within member states. Now, although not exclusive within the global strategy, there is a focus there on primary healthcare as being the foundation for universal health coverage, and what the WHO perceive as being the natural entry point for the integration of TCIM. So within the global strategy, there is a focus on primary care and the delivery of TCIM within primary care specifically. But it doesn't mean, and TCIM within other sectors, it is also covered, but there is that focus that most of it, the WHO estimates, will be delivered within a primary care setting. Again, like most of the strategic objectives, there's two specific directives to it. That's to incorporate safe and effective TCIM services into national and local health-related frameworks and policies for the integration of safe and effective TCIM into health systems. And the other directive is to facilitate the integration of safe and effective TCIM services across the care continuum and life course. Now, there's various models that could be followed in terms of the incorporation of TCIM into both primary care and national health services generally. And at the moment, it's not clear which of these models of incorporation may work best. So one of the other things that the WHO has recently initiated is some work to look at the different models of integration within TCIM in national health services to explore how well those models work and which models may be the best to recommend member states to initiate within their own country. That work's only just been initiated, but hopefully I'll be able to update on how that work goes probably in about a year's time. There's meetings planned in early 26, I think, relating to that, to explore the different models that could be utilised. Then strategic objective 4 is looking to optimize the cross-sector value of TCIM and empower communities. Basically, the knowledge, attributes, and unique value of TCIM serve to address challenges across multiple dimensions. So not just health, but also culture, environment, and social and economic factors as well, including a wide range of knowledge and practices. 2 directives again to this strategic objective, and they are to include TCIM in cross-sector policies, so not just relating to health, but those political policies that go across sectors, and action plans for health, well-being societies, One Health, and sustainable development goals. The second directive relates to developing inclusive approaches and models for the protection of and access to traditional medical knowledge, and for the fair and equitable sharing of the benefits arising from the utilisation of such knowledge and or associated genetic resources. So that second one relates to things like biodiversity and ensuring that within, say, the herbal medicine field, that things like sustainability, biodiversity are being acknowledged and incorporated into any work that's being done within that field. Now, the WHO, because like I say, it's up to member states to decide whether they engage with this strategic policy from the WHO, and how they engage with it and how they implement it within the country. The WHO has set up a group to monitor how the strategy is implemented within member states. For me, sins, I'm also part of that group as well that will be monitoring how the strategy is taken on by member states. And we'll be meeting in a few years' time to see whether this strategic objective has made any differences within member states, and then review whether it might be necessary to make any amendments to the current WHO traditional medicine strategy. Now, that's, yeah, if anybody's got any questions on the TM strategy, you can either ask me now or at the end. But what I'll do is I'll move on to the work that the WHO's doing relating to traditional medicine ICD codes. Now,
has anyone got any questions for John now? Or you can drop them in the chat if you want, or we can just pick them up at the end. Thanks, John. You can go ahead. I don't think there's any questions so far.
No problem. Yeah, like I say, you can either stop me on during the talk or wait till the end. I'm happy either way. In terms of the WHO's work with traditional medicine ICD codes, so ICD stands for International Classification of Diseases, and it's the standard international classification for epidemiology, health management, and clinical purposes. Basically, all countries across the globe use the same ICD classification system to diagnose conditions within their own country, so that we're able to compare across communities or health services within member states, and we're also able to compare across different member states as well. So we can see what the prevalence of conditions are within different countries, basically. It's also used on death certificates as well, for instance. And yeah, if you go to your GP or in the NHS, the ICD code system will be used in terms of how they classify what your diagnosis is. Now, back in 2010, the WHO started a collaborative project to produce an international classification for traditional medicine. Basically, they were keen to understand the prevalence of traditional medicine diagnoses within different member states so that we could see whether there's any difference in terms of the frequency of these conditions according to a traditional medicine theoretical framework between different member states and within different communities, different services within individual countries as well. So the first of these TM-ICD codes related to the diagnostic categories that were used in traditional medicine that originated in ancient China and is now commonly used in China, Japan, Korea, and elsewhere around the world. And this is the Traditional Medicine 1, the first module of traditional medicine within ICD. And the original draft for these traditional medicine ICD codes were based on the classification rubrics from specifically the national classifications from China, Japan, and the Republic of Korea. So it was those three countries specifically that collaborated and formed this unified classification system for incorporation within the ICD coding system. As I mentioned earlier, the WHO have subsequently developed traditional medicine ICD codes for Indian-based medicine, Ayurveda, Siddha, and Unani, and they were launched the very start of this year, if I remember correctly. And that's the Traditional Medicine 2 ICD codes. But yeah, I'll be looking specifically at the Traditional Medicine 1 ICD codes for the rest of the talk. Now, those draft ICD codes that were developed, myself and a number of other academics across Europe and a number of members of the BAcC contributed to this work, but we did a study looking at the acceptability and applicability of the codes to European traditional acupuncturists specifically. What were at that point the draft traditional medicine ICD codes. Study was published, I don't know, probably about 5 years ago now. I can't see off the screen what the date is, but yeah, a few years ago now. And we surveyed practitioners across Europe around the perception of these traditional medicine ICD codes. And the conclusions that you can see in the slide were that European traditional medicine practitioners who participated in the study largely perceived the traditional medicine ICD codes as valuable, conceptually accurate, and incorporating the range of traditional medicine diagnoses utilised within clinical practice. The TM-ICD codes could be improved for European TM practitioners by expanding the scope of TM-ICD codes and adopting a multi-dimensional approach whereby more than one disorder and/or pattern code can be applied to a single patient. Basically, on the back of this study that we did, the traditional medicine ICD codes were amended to incorporate some theoretical frameworks that were utilised predominantly within Europe, such as 5-element acupuncture, so that they be applicable to that as well. And they changed the system so that practitioners were able to assign more than one diagnostic code for both the disorder and pattern. Again, these ICD codes are freely available to to look at on the WHO's website. And again, the HTTPS address is on the slide. And you just go on the ICD-11 browser if you want to look at them. And what you'll see is that it's number 26, Supplementary Chapter, Traditional Medicine Conditions. And that's the one that you click on to see the traditional medicine ICD codes. And that's what it looks like if you go on the TM1 ICD codes. And each of those can be further moved down as well. So if you click on the organ system disorders, you'll then see further codes available. Now, some of you may be thinking now, well, I'm not sure that those ICD codes are good for me and the acupuncture that I do in clinical practice. And you may feel that you want to recommend some changes to those ICD codes. If you do, either you've looked now and you think, actually, I think that they could be improved. Or you go after this talk, you have a look and you think, yeah, I can see ways in which they could be improved. If that is the case, again, on the WHO's website, there's the WHOFIC maintenance platform, and that allows you to propose changes to these ICD codes. And I do know for a fact that at least a couple of UK traditional acupuncturists have already made suggestions for changes to these ICD codes. Yeah, if you do submit any recommendations for changes, that goes to the traditional medicine reference group. And then it's up to us to evaluate those recommendations and to decide whether or not to make any amendments to the current ICD codes. But like I say, if you do want to make any suggestions, that's the web page to follow to do so. Now, relating to the WHO's traditional medicine ICD codes, WHO earlier this year agreed a minimum data set that they would like member states to collect relating to these ICD codes. And currently there's a small number of countries that are piloting this minimum data set, including the UK. And the project aims to collect data on the prevalence of traditional medicine diagnoses and its correlation to conventional ICD diagnosis. Basically the WHO is interested in what the correlation is between a conventional diagnosis and a traditional diagnosis as well, and what the potential clinical benefits are for patients to receive a dual diagnosis as well. So within the UK, I've started a working group that I'm looking to expand to collect this data relating to the traditional medicine ICD codes. We've had a first meeting where we're looking to establish a standardized reporting format for collecting this data. Basically, the minimum data set that the WHO wants is the collection of patients' age, gender, a conventional diagnosis according to the ICD code classification system, the traditional diagnosis, again, utilizing the ICD codes for disorder and pattern, and details of the intervention as well. Now, the WHO have a separate branch, which is the ICHI branch, which classifies interventions. Currently, traditional medicine interventions are not within the ICHI framework. However, again, work has been initiated to include interventions like acupuncture within that official WHO classification system. And there's a meeting in India just before Christmas, which will be looking to explore that in greater detail. Within the UK, because that's what the minimum the WHO want. Within the UK, what I'm interested in as well is also collecting some outcome measure data specific to traditional diagnoses. So at the moment, the vast majority of research that comes out around acupuncture is looking at how effective acupuncture is for a conventional diagnosis. What I'm interested in is also looking at how effective acupuncture is for treating specific traditional medicine diagnoses as well. So yeah, we're hoping to utilize a standard outcome measure for this project. Most likely this will be MIMOP. However, I'm still in discussions with people within that working group around what outcome measure may be best to utilize. A number of other countries piloting this process are also collecting outcome measure data. However, due to differences between each country, the outcome measure will be different for each country, or most likely that will be the case. I'm also interested in collecting data from practitioners or groups of practitioners who aren't able to provide all of that minimum data set. So for instance, although members of BAcC or other traditional medicine professional associations may be able to provide a traditional medicine diagnosis, they may not have the skill set to provide a conventional medicine diagnosis as well. But I would like to include them as well, so that at least we're still getting data on the prevalence of the traditional medicine diagnoses within the UK. And I'm currently exploring incorporating these traditional medicine ICD codes into the NHS's electronic medical record system as well, so that we can collect data that way as well. In terms of the correlation between traditional diagnoses and Western diagnoses, on the slide is some of the data that was derived from the hospital relating to 3 of the main conditions that we see treated at the hospital. So you'll see the conventional Western diagnosis of migraine, which has a code within the conventional ICD system of 8A80. The primary traditional medicine disorder that gets assigned to those patients is migraine disorder, SD10. And you'll see that the 4 main patterns that we see for those patients coming to us with conventional diagnosis of migraine is liver yang. Ooh, somebody seems to be drawing on the screen. Yep. Liver yang ascendant hyperactivity pattern, liver qi stagnation pattern, liver fire flaming upwards pattern, and heart blood deficiency pattern, which each have a specific traditional medicine diagnostic code as well. Apologies for the yellow that's appeared on my screen. I have no idea how it's got there, but yeah, there we go.
Hi, John. Yeah, I'll see if I can find a way to get rid of it. Don't worry.
No problem. Yeah, so that's basically the work that the WHO is doing relating to traditional medicine ICD codes. Now, I'll now briefly move on to the WHO's benchmarks for the training and practice of acupuncture as well. So like I say, the WHO produced these benchmarks for a number of TCIM modalities, not just acupuncture. So if you go on the WHO's website, you'll see benchmarks for things like Ayurvedic medicine, osteopathy, naturopathy, chiropractic, and yoga. And basically, these TCIM benchmarks are developed so that they can be a reference point for policymakers, regulators, to support member states to regulate the safe and qualified practice of TCIM. Basically, to make suggestions for the training within member states, what should be covered relating to acupuncture, and recommendations for how acupuncture should be delivered within those member states. Now, the WHO engages extensively to obtain these benchmarks for TCIM modalities. Like I say, as a WHO collaborating centre, when these draft benchmarks are created, we're allowed to input our view into whether we agree or disagree with what those benchmarks are. But the system is a very top-down process. The WHO identifies experts, they create the benchmarks, and then various stakeholders, including the TCIM collaborating centres, are able to input into their view on whether or not they're fit for purpose. However, what for me is currently lacking within that system is that individual practitioners in member states currently are not consulted on their views on the benchmarks for their discipline. So ourselves at RLHIM, in collaboration with Norway's National Research Centre in Complementary and Alternative Medicine, NAFCAM, and the Korean Institute of Oriental Medicine, are working collaboratively to globally assess acupuncturists, individual acupuncturists in member states' views on these benchmarks for acupuncture, both the training and the practice. So what we're proposing, so the WHO has agreed to this work, and it's in an early stage in terms of developing between those three centres. But the overall aim for that research is it'll survey acupuncturist awareness, because personally I think most acupuncturists are not aware that the benchmarks are even there, and their perceptions of the content of those benchmarks, both for the training and the practice. It'll be an online survey. It'll include both quantitative and qualitative components, so that we're able to use things like Likert scales in terms of to get a view how much in agreement they are with aspects of these benchmarks, as well as some qualitative components so that we can have some free text there to get individual perceptions as well. And yeah, we'll be inviting acupuncturists, hopefully across all the WHO global regions, to participate in this survey. And we'll be utilising the professional acupuncture associations within member states to ask them to distribute the details of the survey to their members, and then for the members to complete the survey. I would hope that at some point in 2026, this survey should be ready, and we'll be looking to collect data. So yeah, please keep an eye out for those invitations to take part, which should come to you through your professional acupuncture association, like I say, sometime in 2026. And that's me done for the talk. My email and phone numbers there, if anybody has any questions subsequently that they think of and they want to get in touch, although I'd recommend using the email, you probably won't catch me on the phone. Thank you.
Thank you. Thanks very much, John. That was really fantastic. So what I'll do now is I'm going to throw it open for questions. You can either put questions in the chat or you can turn your camera on and unmute. I'm going to go to the gallery view. So if you don't want to be recorded, you can turn your camera off right now. And the first question we have in is from Vivian. So she's asking the obvious question about where to apply for funding in the UK. And I'll just tack on to that question. The WHO has this great support for traditional complementary integrative medicine. Does that unlock any funding at all? I mean, have you found? Yeah.
Well, obviously within the UK, your main funding bodies for acupuncture would be the NIHR funding streams, although the big pots of money. Traditionally, although they have funded some research within TCIM generally and acupuncture more specifically, in fact, acupuncture is probably one of the TCIM modalities that has received the most funding from NIHR. It actually represents a tiny fraction, less than 1%, I think, of the total NIHR funds research that they've funded. My hope is that on the back of this global traditional medicine strategy, that it may encourage the NIHR as well as other funding bodies to increase the provision of funds for TCIM. Certainly in my grant applications to them, I will be mentioning this global strategy document and the WHO, and I'm hoping that it will increase the probability of success, though, yeah. I'm happy. Yeah, certainly when we did that meeting in Copenhagen, I raised the fact that actually I personally feel that some of these funding bodies are not inclined to fund TCIM research generally, and it may require a different makeup of some of these panels before they are accepting of the fact that actually the evidence base for acupuncture and other TCIM modalities is that they are clearly safe and they are clearly effective, certainly for specific conditions, as is acknowledged within the NICE guidelines, where acupuncture is within the NICE guidelines and the number of interventions, the number of conditions, sorry, for which it's recommended is increasing and is likely to continue increasing.
It's when I first saw this strategy, it really struck me the four pillars are very much definitely the mission of the British Acupuncture Council, but also a mission of kind of this collaboration of organizations that come together today, strengthening evidence base for TCIM, supporting the provision of safe and effective TCIM through appropriate regulatory mechanisms, integrating safe and effective TCIM into health systems, and optimizing the cost-effective value of TCIM and empowering communities. It's exactly our mission. And so it's amazing to see that support. And I think that the question that I think a lot of us are trying to wrangle with is how do we actually use that the work that the WHO is doing to actually make change, unlock funding, change government policy, those kind of things, as you say, because it's voluntary for each state to just move on to the next question. Are there any in your discussions with different stakeholders, or are there any more sympathetic government or non-governmental institutions in the UK that the WHO message does resonate with? Or has it been a bit of a more...
If I'm honest, too early days to say. Obviously, it's a recent publication, and I've not engaged with any currently to be able to make a statement on that, basically.
Okay, we'll ask you again next year.
Yeah, ask me next year.
Alan,
I might be able to answer.
Alan asks, in the WHO TCIM strategy, is there an explicit purpose for the collection of real-world clinical data?
Yes, there is. They want to increase the amount of real-world data that's being collected, And again, that feeds into that TMICD minimum data set that I mentioned, where there's an intention to collect that real world data around not just the prevalence of traditional medicine diagnoses within member states, but what interventions are being used within those clinical encounters, and ideally, what the outcomes are for participants from receiving that intervention.
Fantastic. So you Reg, has given quite a detailed question here. So if you click on the chat button, John, you can follow and read it while I read it as well. He's asked, is the dual ICD coding a text document or a database output? It seems to be a project to include with the minimum data ID project is to create a relational database to record the many-to-many relationships. That is, one conventional ICD diagnosis correlates to multiple TM1 ICD diagnoses, and one TM1 ICD diagnosis correlates to multiple conventional ICD codes, hence creating a linking table with one-to-many relations to track all these many-to-many relationships.
Yeah, basically, how that data is collected is up to each of the member states that are participating in this pilot project to collect the data. And I can tell you that there's huge variation between the countries. As you can imagine, China, Korea, Japan, they're way ahead of the game in terms of the collection of this data. They're already collecting this data routinely from thousands upon thousands of patients. If I'm honest, I always feel a little ashamed when I'm in these meetings and I'm presenting data from a small sample population, and they're presenting huge data sets relating to this. But yeah, so yeah, they're already ahead of the game in terms of what the correlation is between conventional diagnoses and Western diagnoses.
Yeah, it's a it's a point of frustration for us as well because countries like China, Taiwan, Korea, Japan, they're collecting all this enormous amount of data, and we want it to have impact on policy over here, but I guess some of the work of the WHO to standardize things it may make it easier for us to use that as a case for use foreign country data as a case for changing policy in the UK.
And certainly other countries, for instance, America is participating in the pilot collection of these minimum data sets as well. Within America, the hope is that it will get embedded within their insurance policy system so that patients then with specific traditional medicine diagnoses will get covered for reimbursement through the
And I think maybe we should be looking out for those global insurance providers, because if they're in the US and they're doing one thing, we might be able to, if they've got a branch in the UK, they might be able to bring it over. So that's something we should definitely look out for. The last question before we go to our updates is from Maliha. She says, is there a particular format available for acupuncturists to record their cases so as to make them suitable for incorporation into an evidence base, or even just to report them in peer-reviewed journals as case studies in the way that Western medical doctors do? This isn't necessarily within clinical trials, WHO, but it could help to build an evidence base. I mean, you obviously, John's going to give some updates on some of the other research he's doing. John is quite experienced in acupuncture research. Have you got any comments on that, just in general, about formats for writing up case studies?
Not specifically for, was that for a case study specifically?
I think we're talking about, it sounds like, so I guess they're qualitative. Manly, here, are you talking about qualitative studies?
Yeah,
I think
just really on a sort of par with, the way that, like, for example, the New England Journal of Medicine, you get a lot, or the, what is it, the BMA, British Medical Association, there are case reviews, there are case studies just, looking at individual disease patients with their diseases and how they were treated and just the outcomes reported. And so I was just wondering if there was anything analogous to that for acupuncturists. I know that there are some things like Acupuncture Today and so on, the journals, but I was just wondering if there was anything, individual case studies, because there are so many. Acupuncturists must have accumulate so many of these.
Basically, your rule of thumb for case studies is that, yeah, unless this is something unique, a unique condition, say, for which there currently isn't anything known around how effective acupuncture would be for it, any journal's unlikely to publish it. No journal, for instance, is going to publish a case study around acupuncture for migraine, for instance, because we know it works. So there's no need for them to publish it. Obviously, case studies are right near the bottom of the evidence-based ladder. So the only time where I would expect a journal to publish a case study within acupuncture is if it's some sort of rare condition for which there is no current evidence either way around acupuncture for that condition. And if you are doing a case study, then again, I suppose the best advice would be that you want as much information within that case study as possible in terms of the patient's history and in terms of some validated outcome tool to assess how well that patient responds to treatment and details of the treatment administered as well. But by and large, they're not very publishable.
Okay, well, Acupuncture Today does publish some individual case studies just to illustrate, the sort of treatments and maybe, sort of differences in what is actually commonly used for that sort of condition. So I suppose that would be not so much contributing to your idea of the evidence base, but more, I suppose it's more akin to elaborating the acupuncture's own evidence base for its own purposes.
Yeah, there can be value there in terms of learning from different clinical techniques, for instance.
So one last question just snuck in. And by the way, Malia, there's a lot of useful links and
Yeah,
things
I've
that
just
people in the
seen.
chat for you. Just last one before we go to the roundup is just one from Lily. Is that any information you can provide us about the models that are currently being piloted amongst some of the member states? Any particular models that you might feel potentially work well here in the UK amongst NHS settings? I think this is the integration models, isn't it, that she might be referring to?
Here it is. Evening, Lily. Nice to see you. No, basically not yet. So there'll be a meeting in early 26 where we'll be looking at this in more detail and collecting some data from different member states around how they've incorporated TCIM within them and hopefully learn some lessons around which of those models work best. But yeah, at the moment, the WHO's identified the fact that they need to do this work, but we've not started. We've not initiated it yet. It'll be early 26 really when we look at those different models and look at which of the models may work best.
Thank you.
It's I mean really important work. It's great to hear. So I'm looking forward to hearing from it when it gets published. And I think that as far as I understand, the UK is reasonably fairly unique. I think in the sense that we have this accredited voluntary regulation. It's not quite regulation. It's not quite lack of regulation either. So I don't know if obviously we have a very small amount of integration in the UK, but I don't know if that's something that's of interest to them. You can let me know if they are.
Yep, and certainly within Europe, we're ahead of many member states in terms of accepting certain TCIM interventions are safe and effective, and them already being incorporated into the NICE guidelines and and incorporated into the National Health Service.
That is very interesting to hear. Great. Well, thanks, John. So we're going to go on to the next stage of the meeting, where I want to open the floor to anybody who would like to give an update. So this update can be anything to do with research at all. So it's research that you're trying to get off the ground and you need help with. It's research that you're currently doing. You just want to give an update because you're halfway through and you want to let us know that something is happening, or research maybe you've recently published and you want to let everyone know, or anything else in that field, any other help that you need. What I might do is just quickly drop back to John because he mentioned some really interesting projects that he's got in the works, and then I'll open it to the floor. So maybe let us know what you're working on at the moment, John.
Oh, okay. No, I hope I don't forget any here. But basically, we've got a burgeoning research department at the hospital now, where we've got over 30 research projects currently on the go within TCIM, a number of which relate to acupuncture. And one of the focuses in terms of a program of research that we've got going is looking at whether effective acupuncture can be converted into an effective self-management technique as well. So one of the trials we've just completed, but we've not crunched the numbers yet, is a feasibility trial of acupuncture for chemotherapy, of self-acupuncture for chemotherapy cancer patients, to teaching chemotherapy cancer patients how to do limited acupuncture themselves to address the symptoms of cancer and the side effects of their conventional treatment as well. We're just preparing a grant application for research for patient benefit, one of the NIHR funding streams, where I will be highlighting the WHO's traditional medicine strategy, hopefully to leverage them to make them more likely to fund it. But that will be for a phase 3 definitive trial of acupuncture for chemotherapy-related peripheral neuropathy. That's a collaboration between RLHIM and Christie's Hospital up at Manchester. There's a few people in the audience that is involved in that trial and the development of that trial as well. Certainly Lily and Mandy. We've got a handful of PhD students whose work is in acupuncture as well. So Katrina Davies doing a feasibility trial of self-acupuncture for migraine patients. We've got Rick, who's based in Denmark. He's doing a feasibility trial looking at acupuncture for sciatica patients. Frank Hayes just started doing a PhD as well. He's looking at acupuncture, balanced acupuncture, stroke auricular acupuncture for pain in cancer patients. And we're hoping to announce another PhD soon that will be looking at acupuncture in cancer patients with multi-morbidity. One of the clinical health psychologists that's with us, they've just done a qualitative study looking at adolescents' experiences of receiving acupuncture for chronic pain as well. I think that may be it, but I could be forgetting.
That's a whole lot, John. I just want to just say finally, thank you so much for the work you do, because you're making an enormous impact for all of us. So it's really appreciated. So I'm going to move on. Joe and Nick both asked to give updates, so I'm going to go to them next, and I'll throw it open to the floor. I'll just pin you here, Joe, first. Oh, there you are. So Joe, and if everyone can keep their updates reasonably swift, because I'd like to get onto the discussion session by in around about 10-15 minutes of that. And over to you, Joe.
Hi, yeah, I'm just coming to the end. Oh, getting towards the end of trying to do literature reviews on the biomechanisms of every single acupuncture point, for which we've been sort of posting them on evidence-based acupuncture and doing talks at healthy seminars every month on the big point for each meridian. And then, yeah, come the end of that, we've been prototyping putting into an AI model where then basically anyone can just access it, ask whatever question you want, and it will primarily draw the answer from all of those studies. And then additionally from the wider knowledge base, and then give all the citations as well as a bit of a quality ranker on those studies. Some of it is just animal studies for looking at the mechanisms. But yeah, to give us basically the start of a conversation on exactly how acupuncture is working on a biomechanical level. We've got a lot, I think, on it being effective for different conditions, but actually we don't have the language yet for how and why. And we need, in my mind, we need that to be working towards integration as well. So hopefully at early next year, there'll be the AI tool to play with.
That's really exciting, Joe. And if you want to drop any links into the chat to evidence-based acupuncture, do brilliant work, or to any of the seminars and things like that, please do, so everyone can find them.
Cool. Thank you.
That's great. I'm going to move on to Nick. So if I want to bring you up, Nick, here we go. Hi, Nick.
Hi, everyone. So our update is just an ongoing real world data collection project that we're working on. I see Sandro's here. I'm not sure if anybody else from our group's here, Sandro. Essentially a collaboration between researchers in the UK, US, and Australia. We're looking at a secondary retrospective analysis of real world clinical data. So that's either from published case reports, someone was asking earlier. So we're actually doing kind of an analysis of those case reports from a specific journal, convergent points, and a clinical registry data as well. So it's a kind of combination of that. And the projects will be looking at basic stuff, demographics, clinical outcomes for pain and other outcomes, and also mixed methods research for studying kind of some of the more complex elements of what the intervention involves. Lifestyle advice, dosage, etc. Lots of specific and non-specific factors. So this is just a kind of ongoing work with the data. We're kind of analyzing a set data set, but we're continuing to collect data as well. So if practitioners want to go and publish any cases, if you publish it with the Convergence Points Journal, that might make its way into some of our future research. And I'll just pop in our protocol paper in the chat if anyone wants to have a read. Thank you.
That's great. And is this when do you anticipate this kind of producing papers and published papers and things like that, or is it just you're in the collation phase?
Yeah, so first, the protocol paper was published last year, and we've just submitted our first one for publication. So hopefully that'll be out in early 2026, and that's going to be a quantitative analysis of patient-reported outcomes in this set. So hopefully the first research output will be quite soon, Alex. And the data we're collecting, as well as with John's presentation, we're also looking at those traditional medicine codes. So there'll be a paper hopefully focusing on how we kind of retrospectively coded these diagnoses. And then hopefully our ongoing data collection efforts will feed into John's project as well.
Well, keep us in the loop. And by the way, Nick and Joe and anyone else, feel free to drop your emails in the chat if you want to open for anyone to contact you for the projects you're working on as well. So is there anyone else who'd like to give any update about things that's happening? Sometimes we don't have the impulse to share things that are in progress. And I think that one of the benefits of these kind of webinars is that we can actually we can let people know about what's going on, so it can actually be
could add something.
useful. Yeah, please. Sorry, who's that?
Alex, Yubraj Sharma.
Oh yeah, let me just pin you. Hold on. There, it's up here. Okay, there you go. I got you there. Okay.
Yeah. I've
There
just
you go.
I'm the lead investigator, and we just registered on clinicaltrials.gov an observational case series research project. I mean, I can put it in the chat, the code, the clinical trials ID, and it's a trial for 100 cases minimum of Parkinson's disease patients that I've started a charitable clinic run by the Homeopathy UK charity in Tower Hamlets on neurodegenerative diseases. And out of that, we're picking out 100 minimum Parkinson's disease patients. And it's a real world observational study. So there's no trial here of any treatment. We're just treating them. I'm treating them, collecting scores with the UPDRS scales. And from that data, we're just saying, is complementary treatment helpful for these patients? So every patient is getting homeopathy, Chinese herbs, some Western herbs, healing, and where possible, all of them. But basically, everyone so far has had a Chinese herbal prescription, or some of them Western. So anyway, I'll be collecting the data, hopefully analyzing it with Philippa Ferbart in about 2 years.
Amazing. Yeah, so Lily said, can you please share your trial protocol and keep us updated, and definitely keep the RCHM in the loop as well. Keep us in the loop too, because this is something which is, can benefit us all.
The other thing I could mention, because I'm also a homeopath, in the faculty, I've set up a research board, and it may be in about 2-3 years, we may be able to bring out some training packs on research ethics that could be shared with people.
Right.
Yeah, but I'll keep people in the loop of that.
Yeah, please do. And we're really looking to just reinvigorate the research support at the BAcC, and so all the resources that people are creating, we want to find a way to actually share it with everybody and have that more disseminated in an easy way. Thank you very much, Raj. That's great. Anyone else who would like to give an update? You can.
Alex, I can give a brief update.
Is that Mandy?
It is Mandy.
Let me just find you, and then I'll pin you. There we go. Perfect. There we go.
So well, John actually mentioned my project. I'm one of his hopefully soon PhD students looking at acupuncture for improved quality of life and symptomatic improvement for cancer patients with multiple long-term conditions. Hopefully I'll be starting that early next year.
That's really exciting, Andy. So, and again, John is really the locus of everything happening at the moment. But it's,
I didn't know whether I should mention that it was you, Mandy, when I was doing it. So I thought I'd let you flag up if you was happy for people to know.
I was happy that I'm also will be integrating the TMICD codes into that project.
Very interesting. Yeah, it'd be really interesting to see how these are adopted and how what kind of impact they make going forward, won't it? Yeah.
Yeah, and I mean, those can get hopefully embedded into the those NHS systems as well, but we shall see.
Very interesting. It'll be really interesting to see how it progresses. Well, good luck with everything, Mandy.
Thank
you.
Can I provide an update, Alex?
Yes, of course you can.
Lily.
Lily, I can see you there. Great. I'll just brilliant. Hi, Lily.
Hi. So we're just in the process at the moment of publishing from Southampton a practitioner consensus study on determining the contents of a herbal formula to be trialed ideally within primary care in the NHS for regulating periods with PCOS, which was on the back of my PhD project a little while back. So it was on the back of the MHRA request that we reduce a 14 herb standardized formula that was effective in a feasibility study that we did, but they said they wouldn't be able to regulate and license such a large formula. So there's some sort of interesting conundrums, I think, that we will have with regards to evaluating, I suppose, good practice and having to fit within certain regulatory or licensing frameworks.
So is that licensing it for the study, or is it for like the THR license?
It's essentially for the
potentially?
THR license. Yeah.
Okay, very interesting. Yeah, well, this is all new territory, isn't it? So
Absolutely.
yeah, thanks. And Lily is very graciously helping us out with Acupuncture Awareness Week. Just want a little bit of a plug. 10th to the 16th of November. If you go to the BAcC homepage, acupuncture.org.uk, you'll see a GIF up there with our slogan, the original whole system of health. And Lily's made a video. So if you pay attention to our Facebook channels or Instagram channels on that week, you'll see Lily's lovely video that she made for us. So thank you, Lily. Great. Any other final updates? Great. Well, we'll just before we move to the next section, just to say that a few of us have just had a trip to China. That's myself, Federico, the chair of BMAS, and Martin, who's the president, or Martin John, president of the RCHM, and Ian, who's our research and policy manager. I'm going to be writing a report for our members and one for the public too. But just a few remarks about it. It was very interesting. We attended a very large cancer conference, anti-cancer conference, but holistic medicine was right at the center of it, and Chinese medicine was right at the center of that. It wasn't a holistic medicine conference per se. It was an anti-cancer conference. And it seems like this is something that's a real trend in China at the moment. The level of support that's being put behind Chinese medicine at the moment is really interesting. So I just thought I'd throw that in there at the moment because we don't know exactly what to make of it or how we can take advantage of it. But as we develop ideas, we'll be letting everyone know. And hopefully the contacts that we've made, we can make some progress for maybe some joint research projects in the future. So the next stage of the meeting, we're just going to spend half an hour in small groups discussing quite a broad question. What do we want out of research? What are the goals that we're looking for, and how are we going to achieve them? This is a topic that can maybe lead us to gradually develop something like a research strategy for our whole community. When we're doing research in silos, sometimes that research isn't being disseminated or communicated or coordinated. Sometimes we don't have as much impact as we could have if we were doing it in more of a planned way. And it's interesting because John was just mentioning that the WHO is also currently reviewing its own research strategy. Isn't that right, John? Yeah. And so there's this is definitely in the air at the moment. Oh, hi, Judy. I did not miss you out on purpose. Would you like to give an update now? I'll just pin you. Hold on a second.
If you're in a desperate rush, don't worry.
No. Always got time for you.
Yeah. Get his input maybe. So we did do a recent bit of research. So for those of you who don't know me, I'm joint principal at the Acupuncture Academy in Leamington Spa. So we're a BArB accredited college, and I did my master's in research under Hugh McPherson. So in-house, we just published it in Acu, so it's quite informal, but we did an analysis of referrals, which were kind of suggested self-referrals made to patients by our clinical year acupuncturists. So we had about 10 years of data to analyse. And it was really cool. It was really interesting that half of practitioners referred, 30% for medication reviews. Then there was a range of serious conditions picked up by our acupuncturists. So the form that we used for that and the format that we used, I think, would be easily rolled out to BAcC members and might be quite a cool piece of research, kind of supporting our safety profile, because not only are we safe as a medicine, we also kind of pick up some of those gaps that are appearing in primary care. So that's a thought that I'd like to pursue. My deputy at the college, Michelle, some of you know, is currently doing a PhD at Warwick Uni, and that is exploring acupuncture for trauma in emergency frontline workers. So she would love some funding for that. That's something that we're exploring at the moment. It's kind of being delivered by volunteers through the KIC and so forth. But anyway, that's happening. So I'm kind of informally supporting that in various ways. We've done a lot of MyBot research over the years. We do it as part of the college, and I've got ideas for how to roll that out. But the main report is that people might be able to help me with is I'm meeting with the British Pain Society this week. And that is because they wrote an article in The Guardian a couple of weekends ago about use of acupuncture for older people with chronic pain, who are obviously at increased risk from polypharmacy events. And they were really interested when I wrote to congratulate them on their article, which did mention acupuncture, although not the nice chronic pain guidance, but hey ho. So I did point that out and congratulate them, and said basically they wanted to meet and they're really interested in pursuing what we can offer. So they mentioned this Hope AO project, which, John, is funded by the NIHR. It's got a 250 grand grant, and basically it's an interview study. So they're interviewing 30 old people, and I'm like, God, if they will spend 250 grand on an interview study finding out about old people's experience of taking medication, right? Surely to goodness. Anyway, they're really excited about potentially bringing acupuncture on board as a next phase of that project. The outcomes would be for them potentially changing policy, looking for alternatives to hoover people into. Because I have spoken to the Beyond Pills Parliamentary Party about this and the stuff they're rolling out with the ICBs to basically deprescribe antidepressants. But I think the recent NHS shake-up has cocked things up there. That seems to have stalled it.
Yeah.
But the British Pain Society seems really cool. And I don't know if Mike, you know Dr. Graham Dunthorne, because he's in the meeting. And he is the chair of the Primary and Community Care Special Interest Group in the British Pain Society. And he says he has some training in acupuncture. Doesn't ring a bell? No worries.
No, the name doesn't ring a bell. I know,
No, that's
I
cool.
know quite a lot of people in the Pain Society, obviously.
Yeah. I'm sure you do. Maybe we should get together before my meeting. But anyway, it's interesting.
Best of luck.
Oh, thank you. It's worth a go, isn't it? I just think if we keep making the connections and seeing what we can do, because we've got a lot to bring and we have to keep shouting about it. So yeah, that's a bit of what I'm up to.
Fantastic. Thank you, Julie. That's great. So thank you everyone for coming, especially John. It was a really useful talk, and also for all of your work that you've done, but also for everybody who's participated in all the discussions tonight. It's quite inspiring when we get together. Things feel possible again. So thank you, everybody. And we will be repeating this. We'll be next year. We're going to have a few more research webinars, and we'll definitely have a few of these larger cross-organization collaboration webinars too. So thanks very much, everybody, for coming, and hope to see you at a future event. Remember, Acupuncture Awareness Week is 10th to 16th of November. Please take part, look at our Facebook and Instagram, and share all the posts. Thanks, everybody.